Are you wondering how to treat your under eye bags even though you have used every concealer, every cream on the market? Listen up to this video to find out more. Hi, my name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we're going to talk everything to do with eye bags, treating them surgically and non-surgically. First, what are the under eye bags? These are little poofs that you might see in the under eye area that are actually due to fat that we all have in our eyeballs that with time or just due to genetics starts to become a little bit more prominent, starts to come a little bit forward in the face, and then you end up seeing these literal bags that hang under. And so it is due to a natural structure that you're supposed to have, but inevitably at some point it just becomes more than what you kind of want to have. So what can we do about it? So the easiest thing is you can either fill around it so that way you don't see as much as a bag, and that can be used with traditional filler or fat grafting. But a lot of people who especially have really deep, heavy, big eye bags, we're talking like you would really need a lot of filler, a lot of product to fill around it, and it starts to become a little bit unnatural looking because it's so puffy. So then what do? Now we talk about actually removing the bag, and this can be done only via surgery. So this is not something that non-surgical treatments can really do or take care of very well. It can either be approached two ways, either through a skin incision right by your eyelash line or through an incision that's actually underneath your eyelid. And then what we do as surgeons is we actually dissect down to where those fat pockets are, and we can reduce them or recycle them and use them for something else, so that way they are no longer as puffy or prominent anymore. And that's how we can treat under eye bags. So you are correct. Unfortunately, creams, concealers are not going to do the trick for this. You do need to do something that actually addresses volumetric changes, which is why you see the eye bags in the first place. So I hope this helps someone out there. Leave any questions you guys might have for us below. And this was today's episode of Face the Facts. My name is Dr. Lexie Wang at West End Plastic Surgery. We look forward to talking to you guys next time.